Hello everyone, this is Chadi Alraies from SCAI 2022. With me is Dr. Mayank Mittal. He is from Beacon Medical Group. Mittal, always nice to see you, my friend.
Thank you. Thanks a lot. Thank you for having me.
Yeah, we always brainstorm things related to early career, but definitely you are very thoughtful and giving me, myself, a good advice about how to balance things in life, family and work, but more importantly, how to empty your plate.
Yes.
Tell us
yes.
about it.
So I think it's a fascinating time in our life, and I think interventional cardiology and cardiology in general has so many things to offer. Um, you can almost be chasing your tail, trying to go from one goalpost to another. By virtue and by professional trait, we are high achievers. So, I think we start living the life that you achieve one goalpost, and before enjoying that success and really relishing the fact that you have reached a point which many have not, you start looking at the next one. So, and we start this at early training, right? Passing high school with excellent grades, getting into the excellent medical school. You get into med school, and then you're already thinking about what you're going to do for post-grad. You get into post-grad, and some of us would change countries, not just medical schools. Then you're in a new environment. You go from med school to residency. You enter the residency. Within a year, you have to apply for a fellowship. You finish fellowship, and now you have to apply for a super fellowship. And so you develop this pattern over the last 20 years that if you really are where most of us are standing today in SCAI, you have been successful. And how many times do we really take a moment and say, well, thank you. It's awesome job. How many times do you really take that hand on your own back and pat yourself and saying, it's awesome where I'm standing, with Shadi today and be able to talk to all of you and meet friends at SCAI. It's an achievement. We don't compliment ourselves enough. And what it leads to a sense of emptiness. You start running into this hamster wheel, and the faster you run, the faster the wheel moves. And then you have external pressures on regulation, pressures on patient outcomes, pressures of your outcomes being publicly reported, your notes being shared with patients, revenue, resources, and by the time you take your head off this constant rat race, you realize things that took you here, things that brought you here, things that supported you to reach this victory podium, if I would call it, you've left behind. How many of us have missed Christmas and Diwali? For me, I'm a Hindu, and Eid, and those things don't matter that much because you have a call that day and you have to work late at night.
Yeah.
Your kids are constantly waiting for you at home. You're missing their games and recitals, which is a normal part of life. Before you blink, your kids are standing taller than you. Certainly mine is. Your spouses that supported you in this extreme arduous journey are left behind. You change, you evolve, your personalities change, and next thing, the people that you really wanted to be with, the people you wanted to care for, have moved away from you.
Yeah.
And many of us have unfortunately suffered marital issues as a result. Some ended up unfortunately in divorces with the people that you loved. For what? The profession that you cared for? I have to really rethink the whole strategy. I think I'm been very successful. I'm very blessed to work at Beacon Medical Group and have great success professionally. But all of us have paid that personal price for that. And so I've been reading a lot of books and kind of almost gone on a self-discovery mode recently. In fact, we just met with a professional coach who came to Beacon, and he and I actually ended up getting a dinner, and we talked about how do you define success? Is success just about having another degree, having another FSCI, or a little bit more money in your bank balance? So I think we all have to define what is a success. Where would you stop? Where would you celebrate? And take that time with people that matter the most for you. And if you miss a conference, if you do 5 cases less, then it's not the end of the day. You don't have to be the highest producing guy. I think your kids would love you as much. They loved me as much when I was a resident, and we used to just go for cheap bike rides. And now we can go for whatever vacation we want, but I'm tired. And so finding that work-life balance is very important. And I think as an early career, we sometimes forget that because we still call ourselves earlier careers, so we want to go for the growth. But the growth comes at a cost. So I'm reshaping and reevaluating my plate, and that's the discussion we had yesterday. There is a lot on my plate, but what is it that I really want on my plate, my life plate, and what brings me joy? What gives me happiness? Is it walking in and getting a hug from my daughter? I think that gives me joy.
Absolutely.
Is it helping that patient in the middle of the night when they're coming with a heart attack and making sure that they can go and give a hug to their daughter? Yes, it is why I sacrificed 20 years of my life. It gives me joy. So finding a professional home in a society like ACC and SCAI is really important, because this is where you would meet people. You know, Dr. Lombardi yesterday had an excellent talk. I mean, he's a legendary cardiologist, and he was touching some of these very sensitive topics. I think any one of us would trade our life to become as legendary as he is.
Absolutely.
But then to look at things from his perspective now, it is a wake-up call for all of us that professional life is a part of our life. We are more than just a cardiologist or an interventional cardiologist. And so fill your plate with things that will bring you joy and something that you'd be proud of, and find time for those things. And if it means that, you may be doing something less, well, everybody has to make difficult choices sometimes.
Absolutely.
So,
Mayank, really appreciate your thoughtful comments and input on this important topic. We are, as you said, we are in a type A personality community.
yes.
We want to get things done. We want the grant. We want the travel. We want to talk. We want the procedure. We know the new device to be in the lab in our hands.
Yes.
But at some point, you have to put a break on one of these domains in order not to compromise your family.
Yes, and celebrate the moment. You know, we all achieve something great, whether it is just changing a dose for somebody with a heart failure medicine. That is not that many people can offer, right? And that might seem like a small day for us, but for that patient, when you took that time to listen to them and speak to them, I think it's better than trying to finish that patient and run to the cath lab. Just take a pause, take a breath, and enjoy that moment. We have achieved a lot, and there's many glorious moments that'll be coming in life, but don't be missing out the present in an effort to just keep an eye for the future. Is how I feel about it.
Be passionate, but don't
Be present.
Be
Be present and present. Yes.
Exactly. Thank you so much, Mayank, for your time. I appreciate the advice.
Thank
Please
you.
watch the videos and others on SCAI-TV. This is Chadi Alraies from SCAI 2022 in Atlanta. Thank you.
Thanks a lot.